Hello, this is the news update on NTA International. I am Stella Inameti. Ghana has ended talks for a multi-year aid deal with the United States after Washington demanded access to citizens' personal data. The United States has been striking new health and aid deals across Africa after the administration of U.S. President Donald Trump dismantled the long-standing U.S. aid agency and curtailed the role of NGOs. Ghana's negotiating team included health officials, suggesting it may have been partly tied to health. The U.S. team became hostile and piled on pressure after Ghana pushed back on the demand for personal data. The deal would have provided Ghana $109 million in funding for 5 years, according to the source who spoke to AFP on condition of anonymity, without confirming the specific areas of focus of the proposal. A spokesperson told AFP in an emailed statement that the U.S. State Department does not disclose the details of ongoing bilateral negotiations and suggested the funding would have supported fighting HIV/AIDS, malaria, tuberculosis, and other infectious diseases. There is no sign of a larger hantavirus outbreak after the evacuation of the last passengers from a disease-stricken cruise ship, the head of the UN Health Agency has said. But the World Health Organization's chief, Tedros Adhanom Ghebreyesus, warned the situation could change and there could still be more confirmed virus cases. The MV Hondius left Spain's Tenerife Island on Monday and is sailing to the Dutch port of Rotterdam. 2 flights with a final group of 28 passengers landed in nearby Eindhoven on Tuesday. 3 people have died after traveling on the ship. An American and a French national who previously returned home have tested positive. Overall, 7 cases have been confirmed. 12 employees at a Dutch hospital are now in quarantine over possible exposure to the virus after treating one of the evacuated passengers. The hospital in the city of Nijmegen said on Monday this was a precautionary measure as the workers did not follow strict protocols while handling the patient's blood and urine samples. The Corps Marshal of the Federal Road Safety Corps, FRSC, Shehu Mohammed, has launched a high-level national capacity building program for senior officers as part of ongoing reforms aimed at strengthening operational leadership, professionalism, and service delivery within the Corps. In a statement signed by the Corps Public Education Officer, Osondu Oheri, the Corps Marshal says the Corps can no longer rely solely on conventional enforcement methods in addressing emergency road safety challenges, stressing that officers occupying strategic leadership positions must evolve with realities of contemporary traffic management and public expectations. And that's the news update at this time. Thanks for watching.